Hello everybody, I'm here, Mrs. Brammu, Assistant Professor from SNS College of Nursing. Today to share a few words or to share the glimpse on nursing theory. So we being the nurses are really proud enough to say that we are going to be even nurse scientists in future. But this is only applicable only with our legends who made our profession into a scientist based one, or you call it as a science based one. So to start on with today's topic is that we'll be discussing about the Nightingale's theory. So in the introductory part, I would like to say that Florence Nightingale is considered to be the founder of modern nursing. So just imagine if she was not there during the Crimean War, she wouldn't have brought out so many points towards nursing, and she made nursing to the next level by coining up and bringing out all the significance behind nursing. She also developed the environmental theory, emphasizing the importance that the environment is a major one which heals the patient care. So she added in her theory that not only the medicines are going to heal the patient, but also whatever the care during or the support we give during the patient care, especially the environment. So in this, she has coined that the environment is not dealt only with the physical environment. It also she means on the social as well as the psychological environment, which we'll be seeing in the later slides. So touching up with the review of the historical background, Nightingale served during the Crimean War as we all are aware, and she observed many findings where there were very inefficient, or might be you can call it as poor hygiene, as well as the living conditions were very horrible in the hospital. So she found it that the many of the persons who got wounded and who had severe loss of limb and so other things, she found that they were actually, like, we were missing many of the patients at the especially during the wartime, not due to the infection, but due to poor sanitation and poor air facilities, as well as the proper care was not given, that is the hygienic care. So she found that why can't we improve the sanitation? Why can't we give the patients fresh air, adequate air, cross ventilation, adequately spaced beds from one patient to the other patient, and giving proper hand hygiene and so other things. Thereby, she found that the mortality rates of the patient who got admitted during the Crimean War were reduced. And this made her to bring out or coin out her findings behind the nursing theory. So what will be the core assumptions? The core assumptions behind the theory is that the natural laws, and it is also behind the mankind, where mankind can be able to achieve perfection. And she also called that nursing is always a calling. Nursing is a calling is that whenever the patients are in need, might be it is a social or psychological, or might be it is a physical need, so we go and give or extend the arms to their support. And she also said that nursing is not only an art, it is also a science. That is, whatever activity we do to the patient, might be positioning a patient in case a patient is having breathing difficulty, it is actually going to improve the chest expansion. The diaphragm is getting little lower, by the intrathoracic volume can be expanded. So thereby she is trying to say that this theory is also going to add art as well as science to nursing. Nursing is also achieved through environmental alterations, such as you're giving good ventilation, good support, psychological support, spiritual support, and you're going to give the patient all the needs. Might be you're going to give a hygienic care, going to give the patient a bath whenever necessary, going to do the procedures in a sterile technique, and so on. and also giving the food in a hygienic way. Nursing also requires specific educational base behind all the activity, and we can also standardize the nursing care just by using all the theories which is scientifically proven. And nursing is also going to add as a distinct and separate from all other parts of medicine. So coming to the 10 major concepts of theory, first and foremost in this Nightingale theory we will be coming across the ventilation and the need for warmth for the patient to prevent the drought. And of course we'll be covering some of the major topics, why light is very essential, and noise also play a major role to improvise the patient's sleep. If there is no noise in and around the patient's area, that the patient can enhance a sound sort of sleep. Cleanliness around the area, that is the clean environment which you give around the bed space, in the bed and near the bed. Proper bedding and bed, head of houses, health of houses, personal cleanliness, and a variety which you give in the food to the patient, offering hope as well as advice. The food we preserve, which we give to the patient, is not unhygiene but it is poorly hygiene, and also close observation of the patient. So here in this theory, she's covering on the three major aspects, that is, one is the physical environment, the second one is social environment, or you call it as the external environment, and then you have the psychological environment, which is purely the internal environment of the patient. So the physical environment where you're going to give, or you're going to give a cleanliness around the bed space, proper ventilation in the patient's room, good air support, good adequate lighting, and you're going to give reduced noise or no noise, adequate water to the patient, adequate bedding, proper drainage facility, and good diet, that is nutritious diet to the patient. And in social environment, you're going to give all the preventive aspects of health teaching to the patient, and in case of a psychological environment, you're going to have cues from the patient, find out the physical and the emotional cues, whatever the patient interacts during the interactive session, and you're going to be a counselor or might be a supporter by encouraging the psychological space as well. So these are the three major environment which is telling in depth of how we can give and how we can improve the patient care. So from this picture you can see that it is all well ventilated, there is good spacing, the patient is also getting the sunlight. So here she means that Nightingale is referring the light which is the natural light, and the ventilation which is the oxygen which we deliver it from the environment space. And if we are going to give in such a well ventilated hospital, hospital not like a well ventilated wards, then the patient is going to improve in his oxygenation. Coming to the point on cleanliness and sanitation, so here you can witness in this picture that the OT nurses are doing the carbonization, as well as they're going to do the carbonization of the OT table, the source of light, as well as the floor space. So all these are actually to be done to maintain strict aseptic technique, thereby preventing infection of the patient. And whenever we give a diet, that should be well hydrated to the patient, and it must be in a very balanced one, and as well as it should cover the therapeutic aspect of the patient, and see that we are going to provide adequate rest and sleep to the patient, which is going to improve both physical as well as emotional healing. So last but not the least, we are going to discuss on the relevance of theory of this Nightingale's theory in nursing practice, as well as in nursing education and research. So in nursing practice, this is actually going to control the disease, or you can call it as it is acting as an infection control one, and it's going to improve the sanitation and water treatment. Here you can also see that it is going to improve the prevent the sick of building syndrome, and waste disposal will be segregated in a proper way, And as well as you can see, it is going to control the room temperature by giving warmth to the patient and noise management. And when you take this theory for educational aspects, you can apply these principles in nursing training to the students, as well as you can skill the measurement by using the testing methods such as case studies, whether they are applying in each and every case when they give the nursing care. And in research, you can use this as a graphical representation, like a bar or a pig diagram, you can show it, as well as you can take notes on nursing. So application of theory in nursing process. So always we all know it starts with assessment and then the goal, the diagnosis, the goal, and finally the implementation or interventions with the rationale, finally the evaluation. So in the assessment phase, adequate whether the patient is ventilated, we can go and see, witness around the patient bed. We can also see whether the area of the patient is very much clean and there is any presence of drought, that is the cold atmosphere you're going to see, any sudden noises, the adequate amount of sunlight and artificial light which is given into that particular room, variety of dietary, whether they are changing the diet pattern or whether it is very monotonous, and as well as the order around the wards, the smell, and the method of disposal of all the waste and sputum which is being collected, that is also being recorded, and the opportunity whether the patient is able to communicate with others, and you're also going to see how far the family is being accompanied during the patient care, as well as you are also seeing or cross-checking the knowledge regarding the patient's disease. And in nursing diagnosis, as a nurse, we're going to provide a non-stimulating environment to the patient. So here when it comes to implementation, you're going to provide adequate ventilation by opening the doors and windows, keeping the environment clean, especially the linen bed, utensils, etc., whichever come to the patient contact, always keeping the patient warm and comfortable, and increasing the stimulus by improving the sunlight and fresh air to the patient. Always you're covering onto the patient's nutritious diet as well as encouraging the liquid intake, and very proper safe disposal of all the blood and body fluids that come, as well as to remove the odors. So when it comes to the application of nursing in today, now this Nightingale's theory is actually playing a major role by starting with infection control. We all would have been witness when we were working as a nurse, and even the student nurses will be seeing all the infection control nurses who comes and like a police, they come and they catch and right hand whether you're doing the 7 steps of hand washing, whether the 5 moments of hand hygiene is being maintained. So we can easily witness that still Nightingale is living with us by this infection control program. And then you can see the hospital design, that is the bed strength, might be it is a ICU design, or it is a ward design, or might be it is a general ward design. Here the adequate spacing is being mentioned by the hospital design, as well as holistic patient care. Nowadays in each and every hospital we come across this word, that is holistic. We are going to give the patient not only the physical and the psychological support, as well as the social, emotional, as well as some of the hospitals also provide spiritual support. And here come, and in all the community health practices, this Nightingale's theory is being applied in day-to-day daily. So to conclude, Florence Nightingale has laid out the foundation of modern nursing, and she highlights that the importance of nurses' role in creating a healthy as well as healing environment. To nurses is to put the patient in the best condition for nature to act upon him, which is well versed said by Florence Nightingale. So with these quotes in the content, so thank you for your patient listening. Thank you all.